Hello, dear all. I'm going to talk about the functional effects of common cerebral palsy treatment methods. I'm Orsolya Gresits. Thank you for the kind introduction. I'm a full-time PhD student at the Department of Orthopaedics, and I want to work in a healthcare system where scientific research results are implemented more quickly into daily clinical practice. And to achieve that, my mission is to contribute to high-quality science to improve cerebral palsy treatment. I have two projects in this program. The first one is called the Efficacy of upper limb botulinum toxin A therapy compared to non-invasive treatment methods in cerebral palsy. First, I want you to imagine a child, a disabled child, like her. You have it? Great. Now you have cerebral palsy, because that's the leading cause of childhood disabilities. And about 80% of them has an increased muscle tone called spasticity. There are different treatment options. One of them is the intramuscular botulinum toxin A injections, aka the Botox. They are widely accepted and used in cerebral palsy treatment. They have a 3-month-long temporary spasticity reducement effect, but recent concerns about long-term safety has risen, and we are still unclear on the functional benefits. So in this project, we aim to compare the effects of Botox and physiotherapies on upper limb function in cerebral palsy. So we've been asking what is the efficacy of upper limb botulinum toxin A therapy compared to placebo or physiotherapies in cerebral palsy. Conducted a systematic search. Please see my flowchart how we ended up with 13 different studies. And I'm going to show you different forest plots today, actually 3 of my 6 plots. They always will be glued like, do I have a pointer? No. Okay. So the upper half, the first subgroup will be about the ones measured during the Botox effect, so within the first 3 months. The lower part is after the Botox is already vanished. The first graph is about the elbow-spasticity measured by the so-called S-word scale. Kids in this study had this scale between 0 and 3. 0 means the normal muscle tone, while 3 is seriously increased muscle tone. There's a huge heterogeneity in this graph. That's most probably because of the individualized muscle selection, meaning that some elbows were injected, some not, then an average was made. And still, there's statistically significant and clinically relevant change in this S-word scale during the Botox effect, which vanishes after it's washed away. So that's how Botox works. This graph is just to show you that it does what it has to. The second and the real result I'm showing you today is the mean difference in the Melbourne assessment of unilateral upper limb function. Please see the assessment kit on the right side. The kid needs to perform different tasks like drawing and then gets a point based on the performance. The higher points indicate better upper limb function. This scale is from 0 to 122. There was a 3-point change during the Botox effect and a 2-point change after the Botox effect. They're not really meaningful nor statistically significant. My third result is a very similar upper limb functional measurement tool, the assisting hand assessment. Really similar. The kid also needs to play and then gets assessed how this kid manipulates these small toys. There was a 3.5 and a 4.4 mean difference, also not significant, not really clinically meaningful. The fourth result I'm showing you today is about the satisfaction, because in accordance with our clinical practice, we found high parent satisfaction in all botulinum toxin groups. Unfortunately, we won't be able to pull those results to make forest plots, but as you see, there's a graph from one of my articles reporting the percentage of parents said the treated arm was better or much better. The first two groups had Botox, the second two had no Botox. I think that's quite obvious. Summarize, the strength would be the great generalizability, because we had quite a homogeneous population over the all 13 articles and very similar intervention process. And also the evidence level, because we included only RCTs and almost 500 patients. On the other hand, the limitations are the heterogeneity in the measurement tool. That means we had 5 different measurement scales addressing upper limb function and 9 different scales addressing general function. That causes us difficulties in pooling and interpreting the results. And also there was a heterogeneity in the injected muscles, as I already told you about. I want to conclude that upper limb botulinum toxin A therapy works as a muscle relaxant, and that parents are very satisfied with the results, but only slight functional benefit can be shown with the current tools. So we think there's a need for a new measurement tool which addresses the Botox effect correctly. And I think I cannot state any novelty as a clinical implication, but there's 3 topics where further research needed to be done. The first one is this new measurement method for botulinum toxin effect. We need to design more studies to address the repeat Botox issues and also the long-term safety problems. Let me move to my second project with the title, Does Femoral Derotation Osteotomy Improve Gait in Cerebral Palsy? I have the very same population, cerebral palsy here. They develop gait difficulties over the time, like the in-to-in gait. There's a major surgical procedure called the femoral derotation osteotomy to resolve this issue. You can see the concept on the right side. It's a routine surgical procedure. It's done, but we don't know if it's really good and brings a better gait function. So we aim to clarify if FDO has a positive impact on the gait function or just brings better cosmetic results. Asking, does femoral derotation osteotomy lead to an improved gait in cerebral palsy? And the clinical implication would be aiding orthopedics in setting up sufficient surgical indication for this major surgery, and also aiding patients and caregivers in reaching an informed decision. I'm currently at the abstract title selection phase with this project. Summarized, I have 2 projects. Hopefully I will be able to submit both this year. And I want to thank you with this Disney Cinderella quote: have courage and be kind. Where there is kindness, there's goodness, and when there is goodness, there's magic. Thank you.
Can you go back to the first project where you presented that 3 diagram?
Which diagram you mean?
This one.
Yep.
So if I heard it correctly, they compared Botox with no Botox with the parent satisfaction.
Yep.
And were there any articles about Botox versus placebo?
Thank you for your question. There were several articles with several comparators. In this study, we had 4 groups. The first one had Botox plus occupational therapy, which is a kind of physiotherapy. The second one had just Botox. The third one had occupational therapy. And the fourth one, control. In this study, they didn't have any sham procedure or placebo, but there were studies when there were a sham procedure or placebo, and there's still higher satisfaction with the Botox group compared to placebo. So yes.
Okay, thank you.
Thank you very much for your presentation. My question is that are there any side effects or adverse events about Botox treatment?
Yeah, thank you. Generally, it's a safe thing. Some do it under general anesthesia that might have some side effects, but not really. So in this low dose, no specific side effects. We are also collected adverse events, and most studies find that there wasn't any specific adverse event. Usually, the adverse event rate was similar in the Botox and the control groups. So no, they are generally safe.
So my question is that it's pretty similar, like in my case, that they changed the modified Ashworth scale to numerical rating scale because it was not patient-specific. I understand and I know that numerical rating scale and visual analog scales are too patient-specific in a way, but do you think that it could better show the result and the effect of Botox than this Ashworth scale?
Ashworth scale is an objective scale.
Yes, naturally.
So it's not like the visual analog scale. There's really defined how the assessor gives the points. So I don't think I really get your question.
You told that this Ashworth scale was not really specifically showed that the effect is as good as what you see. Am I right?
No, the Ashworth scale had, the other side, that had a significant decrease.
Oh.
So yeah, that's the objective one. That had a significant decrease.
Sorry,
I
lost.
The other, yeah, sorry.
Okay.
My mistake.
Then, no, I lost. Okay, thank you. That was all.
Let me just ask one very quick question. Long-term effect of a Botox injection.
Yeah, the thing is, the recent concern, they are about the muscle consistency, muscle fibrosis, and the question is if they are due to the natural pathogenesis of cerebral palsy, or maybe Botox somehow worsens it, and we don't know yet, because that's quite a new topic. They haven't really made any researches before that, which is, I don't really know why, but